welcome. Welcome to today's information webinar on the Healing Healthcare Initiative. It's great. I see so many amazing names, amazing people in the room joining us today, and we are so excited to be here with you to introduce the Healing Healthcare Initiative and the pilot project that we are going to be launching in January with applications launching next month. My name is Casey Kudesia. I'm a program manager for the Schwartz Center, and I'm joined here today by two fabulous people. One is our Chief Medical Officer, Dr. Beth Lown, who is really the heart and soul behind the Healing Healthcare Initiative, and she'll be talking about what this looks like in a few minutes. And I'm also joined today by Colleen Manning, who is the Director of Research for the Goodman Research Group, talking to us later about the research project that will be part of the Healing Healthcare Initiative pilot. So before we get started, I just want to tell you a little bit about what we're going to be doing today on the agenda. First, you'll be hearing from Dr. Lown about what the Healing Healthcare Initiative is, the rationale behind it, really what goes into the initiative itself. I will then talk a little bit about the program experience, what you can expect as you join the pilot, if your team joins the pilot. And then we will hand it off to Colleen to talk about what the evaluation process will look like for the Healing Healthcare Initiative pilot. And then we'll close out by talking about both how your team can apply to become part of the pilot and get your questions answered at the end. So looking forward to this. I'm going to pass it off to Beth to tell you more about this pilot.
Wonderful. Thanks so much, Casey. And I'm very excited to be really explaining all of this to you. We're very excited about this initiative. The Healing Healthcare Initiative, we call it HHI, so I'm going to abbreviate that way, is a senior leadership team education and support program for organizational change. This initiative is for leaders because leaders set organizational culture and priorities, and leaders themselves are struggling and suffering right now as well. HHI will guide leaders to reimagine their organization's operations so that health workers can find strength, experience safety, and receive the support and resources they need to prioritize their well-being so that they can provide compassionate, equitable, and safe patient care. Why HHI? It really is time to heal our system so all of us can heal our patients. The Schwartz Center has always honored and celebrated the strength and compassion of health workers who give so much of themselves all the time to care for patients and families. But right now, they are exhausted, stretched thin, and burnt out at best, and at worst are anxious, depressed, and suffering from traumatic stress. And this is resulting in absolutely unprecedented health worker shortages, as I'm sure you are all aware. The convergence of these circumstances present risks to patient quality of care, to patient safety, and it directly impacts organizational financial stability. Let me show you what I mean. Right now, 60% of health workers are experiencing burnout. In the next 2 years, 40% of nurses, 33% of advanced practice practitioners, 24% of physicians are planning to leave practice. The financial implications of what's happening now is enormous and extremely costly. You can see the cost to replace a nurse, 40 to 50, 60,000, depending on the specialty of the nurse. For a physician, it's about 500,000 to $1 million, with lost productivity, referrals, and recruitment costs. And organizations are just scrambling to meet staffing needs using travel nurses, but the agencies that employ these nurses have increased the hourly rates they charge by 213% in 2022. It is estimated that hospitals can save about $3 million for every travel nurse position eliminated. But I think it's really the impact on morale, on team cohesion, and the impact on local wisdom is really profound when experienced nurses leave. And the impact, of course, of health workers' burnout and poor mental health also is very significant and has alarming implications. Nurses are 71% more likely to have medical errors when they report poor mental health. And 78% of physicians who report medical errors are also reporting symptoms of burnout. So there's a direct correlation to how we're feeling, what we're experiencing, and what kind of care we can provide. These are very, very challenging times. There's just no doubt about it. The problems are complex. It can feel overwhelming, but it doesn't have to be. We are here to equip healthcare leaders in developing and implementing the right roadmap for their organization to sustain their business, their workforce, and the patients they care for. We have to shift our mindsets, change culture, change the system. We have to shift from thinking about the workforce as costs to be contained to knowing that health workers are people with enormous insights to contribute and talent to develop. Our system works in silos. We are based in teams, of course, and departments. And there's a lot of good work going on, but it's often being done in silos instead of in an integrated way across the organization or system. And so we want to integrate this work. That's part of the purpose of HHI. And we want to elevate our shared purpose of promoting our collective well-being so that we can deliver the kind of care we want to deliver. Many of us are feeling a loss of autonomy, and that administrators should just get out of the way so we can get on with our work. But we have to shift that thinking too. Our organizations will flourish only when we work together and everyone feels that we matter and matter to each other. And also administrators and executives have to understand there is so much more work to be done. We have to invest in comprehensive solutions that we know will change workplace culture and address the underlying systemic barriers to well-being for all of us, including patients and families. Early in the pandemic, we knew at the Schwartz Center that health workers were experiencing acute stress and trauma, which would have profound, long-lasting repercussions. After a deep dive into the research about the impact of psychological distress and trauma on service workers, health workers, after doing hundreds of interviews with leaders and trauma experts, I really was struck by the Substance Abuse and Mental Health Services Administration's Trauma and Justice Strategic Initiative that describes the concept of trauma and a trauma-informed approach for patients and populations. And it occurred to me that this would be incredibly useful if we could adapt it to apply to health workers. So we convened a national advisory group and adapted these concepts and created a framework of key principles and areas for implementation of these principles that apply to sustaining the healthcare workforce today. This framework, the HHI framework, includes 6 key principles that create cultures in which all who provide and receive care experience compassion. Our vision for truly wonderful care. These key principles are psychological and physical safety. Leaders create an environment that health workers and patients can trust to insulate them from physical and psychological harm. Inclusion, voice, and choice. Leaders involve and include health workers in decisions that affect their work-life balance and ability to provide relationship-based, high-quality care without undue administrative burden. Diversity and equity. Leaders initiate efforts, participate, and commit resources to promoting equity and identifying, addressing, and dismantling all forms of structurally embedded discrimination across the organization and system. Team cohesiveness and collaboration. Leaders provide opportunities for health workers to learn about and from each other to foster mutual respect, share knowledge, and share their perspectives. All of this contributes to team cohesion and collaboration on common goals. Trust and trustworthiness. Leaders share organizational and operational information and decisions with the goal of maintaining trust. Mental health and well-being. Leaders highly value health workers' mental health and well-being and demonstrate in their strategy decisions, policies, programs, and resource allocation a commitment to this key principle. you'll see that all of these key principles are really interdependent. This is a very holistic framework. You cannot have mental health and well-being without diversity, without equity, without trust, and all of the other key principles. The framework also includes several areas for implementation, really to create enduring change that will hardwire these key principles in operations. And these areas include leadership and governance, assessment, performance improvement, monitoring, engagement and involvement, education, and professional development. The HHI approach really exemplifies the key principles in action. And I think the point to take home here is that at every point in the development of initiatives, policies, protocols, programs, decisions about resource allocation, the senior leadership team is charged with asking the key questions. How will this change mental health and well-being, psychological and physical safety, inclusion, voice, and choice, diversity and equity, trust and trustworthiness, team cohesion and collaboration? I want to just quickly sort of work through an example so you get a flavor of this. Let's say the leadership team decides on implementing the goal of working on workplace violence. The first step is really getting very, very clear about very specific goals, of course. So the leadership team decides on an immediate goal of creating an organizational and local police department protocol for responding to workplace violence that accounts for patient capacity and defines criteria for police involvement. So the team might begin by clarifying definitions and the types of violence they want to use, reviewing current policies, protocols, analyzing current data and how they're really collecting data, and also data trends. The team might decide to look at utility and usage of reporting systems, barriers to reporting, data review process, and what kind of follow-up and support both victims and witnesses receive. Before and during the development of a new protocol, workers from the areas most affected by workplace violence are gathered or surveyed about challenges, unit hazards, potential solutions. It's the frontline folks who know a lot about solving problems. And it's after that that the HHI leadership teams can convene key stakeholders for protocol development that includes the discussion of any change or any protocol and any subsequent spin-offs and programs or whatever for mental health and equity and all the other key principles. And in this case, in addition to organizational stakeholders, including healthcare workers, the team might choose to include community partners, the director of police response, liaison teams, and so forth. So the leadership team then has to figure out how to involve its communication teams to communicate what's happening, to gather feedback, and then move towards typical quality improvement methods for testing and improvement. So by the end of this process, some of which may look familiar, some of it perhaps not, the team will have clearly defined goals and measures to follow and a concrete, collaboratively developed protocol and implementation process for responding to workplace violence using that impact lens of all of the key principles. And they'll have the HHI learning community, you'll hear about that in a second, within which to gather resources, hear what's working elsewhere, and to gather feedback on what they're working on. That's just a brief example of how this might play out. I think the key point is you're using the lens of this holistic framework to inform every decision that you make. Before I turn it back over to Casey, I want to talk just for a minute about the spirit of HHI. We hope that this will provide a forum to refresh and to support the spirit of commitment to compassion among our members and among their leaders. That HHI will mitigate some of the exhaustion and rekindle a renewed sense of collective purpose among those who join us in this initiative. The concept of this is really large and the tasks may feel daunting, but the spirit that will guide the Schwartz Center's implementation is familiar, tried, and true. We will offer our support and provide resources to enable teams to create the best possible path forward for their unique organizations. We'll offer safe space in sessions of the program for leaders to reflect not just on the hard work they are doing, but on themselves what it means to them to be compassionate leaders, and on how they are working with each other as a team, because we want these teams to also embody and behave according to these key principles. We hope that by the end of the experience, the leadership teams really will reflect all of these principles. And we aim to inspire more inclusive, less hierarchical communities, communities in which everyone feels valued and empowered to play an important role in creating health for all. Some of the activities that you'll experience in this program will include cohort-wide program meetings for learning, Schwartz rounds that will facilitate. We have a wonderful leadership coach and trauma-informed care expert in Ken Epstein, a social worker who's really an expert on relationship-centered learning and leadership. We have some terrific experts and teachers who will join us during our learning collaborative sessions. Ron Carucci of Navalent, he's the co-founder and managing partner. This is an organization that consults globally on organizational transformation and leadership development. He's written a number of terrific books. If you're interested, I really enjoyed To Be Honest, Lead with the Power of Truth, Justice, and Purpose. I highly recommend that. Dr. Amy Edmondson may be known to some of you. She's a professor of leadership at Harvard Business School, and it's her research that really put psychological safety on the map. She's also a terrific teacher and speaker. And we have also Dr. Karthik Sivashankar, who's a psychiatrist. He's VP of Equitable Health Systems Innovation in the Center for Health Equity at the American Medical Association. He's also a medical director in quality and safety and equity here at Brigham and Women's Hospital in Boston. Excuse me. We will have implementation support from Oliver Wyman, healthcare strategists. These are senior members of Oliver Wyman, another global consulting company. And we'll have impact evaluation with our partners from Goodman Research Group, and you'll hear about them in a moment. And I'm going to turn this back to Casey.
Thank you, Beth. So now I'm going to talk a little bit about what this will actually look like for organizations that join us for the pilot, now that you've gotten the sort of big holistic overview of what HHI means. We'll talk specifically about who will be on an HHI team. So an HHI team needs to have the executive sponsor, who is the CEO, president, or an equivalent role within your organization, who's responsible for naming the leadership team that participates in the program. In addition to that person, the HHI team is 4 to 6 people who report directly to that executive sponsor, who may include the CEO, also other roles like CMO, CNO, COO, etc. We know that some organizations are structured differently and might not have those exact roles, but we're looking for those folks who are senior leaders reporting directly to that executive sponsor of that organization. And these will be the people who in just a moment I'll talk about what they're required to do as part of the pilot, but they'll be participating in a lot of the activities, the learning collaboratives, the components with the experts that Beth was just talking about. In addition, once your team has figured out which directions you're going with your HHI pilot, you will be naming an HHI organizational committee, which includes 10 to 15 people who represent a broad swath, an inclusive part of your organization to allow voices participate in the implementation planning around your HHI projects. So moving forward, this is what the teams will be committing to. So every HHI team that joins the pilot will be able to name that leader of their HHI leadership team, participate in those meetings, the learning collaboratives, the opportunities to meet with Ken Epstein, and also those, if your team chooses, the mentors with Oliver Wyman. Also participate in the research activities that Colleen will tell us more about in a few minutes, and make sure that we're we're doing action, convening that HHI organizational committee and informing projects and really working through the full year to make change happen holistically within the organization and report out on that change and progress at the HHI HHI symposium at the close of the project and also throughout it at HHI meetings. The executive sponsor is committing to organizational change, and that's a really big piece of this, making sure that we are committed to taking a holistic approach to organizational change and well-being. And part of that means also securing board support and keeping the board apprised of the changes that are happening through the HHI project. And supporting and sustaining these programs beyond 1 year. We know that culture change does not happen in a single year. While the pilot is 1 year long, we hope that the change continues, the work continues past this year. That organizational committee will be committing to convening regularly to advise and plan the implementation of the projects and really represent that inclusive, diverse perspectives from the workforce to inform the HHI projects. On this slide, you can see what a year of the HHI pilot will look like. From January to March, that first quarter is when we'll do a kickoff with all of the pilot teams to level set and make sure teams are ready to undertake the work and start doing action. There will be opportunities for learning about the key principles through asynchronous learning modules. The opportunity to participate in expert-led Schwartz rounds hosted by Beth Lown, who is a fabulous Schwartz rounds facilitator, one of, sort of the key expert in that space, and also participate in that team building work with Ken Epstein. In the second quarter of the year, there'll be the opportunities to participate in the learning collaboratives with the guest experts and also implementation planning and action happening. And that implementation planning and action will happen throughout the full year through to December. You can expect that there will be more team building activities, a mid-course checkpoint, and finally an additional Schwartz round and a closing symposium. So that is the year of the Schwartz rounds, the HHI pilot with the Schwartz Center. It is about approximately 15 meetings for that leadership team to come together either with themselves or with us as part of this pilot. And we assume that there's going to be additional work that the team will be taking on separate from those meetings. So as you are considering whether or not this is a good fit for your organization, we want you to have this background of what meetings we're going to be hosting and having. I'm going to turn it over to Colleen from Goodman Research Group now to talk about this evaluation.
Hi, everyone. Very pleased to be here today. And Goodman Research Group is very pleased to be partnering with the Schwartz Center to evaluate this new and exciting initiative. What you see on the screen right here is a tool that evaluators sometimes use to help understand the theory of how a particular program or initiative is assumed to work. And so we thought it would be helpful to share this with you today. This is our logic model for this new initiative. And it shows, reading it from left to right, it shows on the far left the key inputs for the initiative being those principles that Beth described earlier. And using those principles, the team has created a strategy for change, and that strategy is education and support for organizational leadership teams that are framed around those key principles. If that strategy is implemented successfully by the Schwartz Center, there will be some outcomes for the leadership teams that participate. They'll get to learn about the principles. As teams, they will coalesce around a plan to integrate those principles into their strategic plans and then actually begin the work of implementation. If the leadership teams do that successfully, we can expect to see some outcomes in their workforces. These outcomes will depend on which of the key principles the leadership teams decide to focus on and what they decide to integrate into strategic plans and initiatives at their local levels. but we may see increased sense of job control and feeling valued, feeling increased social support, a sense of inclusion and belonging, and perhaps decreased stress and burnout. And the extent to which those outcomes are realized at the workforce level will presumably have an impact on the organization as a whole, and that one of those end impacts is improved engagement and retention, as well as just an improved culture of compassion and compassionate leadership. So this is a tool that will help us, will guide our evaluation of the Schwartz Center rounds and allow us to think about what to collect data about, when to collect it, and from whom. And we're going to say a little bit more about that now, if we can move on to the next slide. So here are some of the key charges for Goodman Research Group as we conduct this evaluation research. First of all, in order to do research with your organizations, we will need to go through your local IRBs. We will take the lead and do all the heavy lifting as far as that is concerned. We have evaluated Schwartz Center rounds and other initiatives implemented by the Schwartz Center, and we have a lot of experience working with IRBs, and we are able to complete the protocols and provide the instruments, and generally just require a lead person on your end to sort of be the PI, if you will, locally. But we'll do the heavy lifting on that. We are already in the process of developing and validating some instruments and metrics. And those metrics and those instruments and metrics will be shared with you. And so the evaluation, while it is meant to in real time help improve and allow the Schwartz Center team to make mid-course corrections to the initiative as it's unfolding, the idea is also that this evaluation will benefit each participating organization by guiding you in collecting some relevant metrics to whatever initiative you design and implement. And we're thinking about helping create a compassion dashboard, if you will, that would feature those metrics. So that could be something that, beyond improving the program, really helps each organization learn about the impact of the initiative locally, and also signal to your workforce that these principles are important, and that you are taking action on them. We are going to, back one more, please. We are going to track your organization's engagement with and experience of the initiative, assess the initial outcomes, help identify under what conditions the initiative is successful or not. So that will involve looking at which components really help explain better outcomes, and then making recommendations. And now I'm ready for that next slide. Thank you. So more specifically, the activities that HHI leadership teams will be asked to participate in include, as I said, one team member to serve as a liaison to secure the IRB approval. We will be interested in what your organization is already doing in terms of the key principles. So existing initiatives and policies and procedures that may be relevant. We will gather those through what we're calling an organizational practices form, and one team member should be sufficient to complete that. That person may need to consult with other team members or other stakeholders within the hospital or organization, but one person could complete the form. All participating team members will complete surveys, online surveys, both at the beginning and at the end of the initiative. We will also do some midpoint and some end of initiative interviews for some of that nice qualitative data and anecdotes and so forth. And then we are going to work with each team to help us identify a subsample of your workforce, your healthcare workers, and survey them as well so that we can assess the impact of whatever it is that you decide to design and implement within your organization and for whom you implement it. And so that would end up informing which subsample of healthcare workers we go with. So that's a lot of information. All of this will be gone over in much more detail with pilot teams that are selected to participate, but it gives you just an idea of some of the aim of the evaluation and some of what will be asked for from participants to cooperate with that effort. Back to you, Casey or Beth. I forget who's up next.
It's me. I'm going to talk a little bit about joining the HHI pilot. There are some questions already in the Q&A, and please feel free to enter some in if a question arises in your brain as we talk about what we're looking for from applications into the HHI pilot. And right after this, we will do an FAQ session. So eligibility and next steps. For the pilot, we are looking for 6 US-based Schwartz Center healthcare members who are in good standing as Schwartz Center members. So if that fits your organization, then please consider applying for the pilot. The next steps are that the application will become available via email and will be sent out next week. So please keep your eye out. As people who attend this webinar and as Schwartz Center members, you will be receiving an email with an invitation to apply. In that email, there will also be supportive materials, including checklists for readiness to make sure that you have everything set up so that you're ready to fill out the application. And also some templates, some email templates for you to share with an executive sponsor in case that isn't you and you're looking for your executive sponsor to buy in and have a team be part of this pilot. So all of that is going to be coming to your email along with a recording of this webinar. So I know someone asked it in the Q&A, and the answer is yes, there will be a recording of this webinar available to you as part of that follow-up email. And that follow-up email will be coming the week of October 3rd, which is next week. We are asking that teams complete and submit their applications by October 31st. So I know that's only a month of time to get people bought in and ready to participate. So do keep your eye out for that email and all of the materials for applications. In the meantime, if there are questions that we don't get to today, or if you think of a question after we log off today, please feel free to contact membership at theschwartzcenter.org with that question, and we will do our best to get back to you about the answers as we are able. I see that there's 7 new questions in the chat, and so I'm going to let Beth finish up, give you some more time to ask some questions, and we'll start answering.
I just want to say that I feel like we're seeing the beginnings of a movement here. I think that people are really starting to pay a lot of attention to burnout and to all the other mental health issues that are rising in the healthcare workforce, not to mention the staffing shortages, and the costs are significant. So I think we have some wind, beneath our wings. Now is the time. People are paying attention. Government funding is being allocated. Your organizations will benefit. And I think that together we can really create some some real change and to really start to pay more attention, perhaps, or to re-elevate the excuse me, the importance and the priority of care that's compassionate, equitable, safe, and effective. So that's my parting words of aspiration. Let's start to look at some of the Q&A, Casey. So the first question is, do I understand correctly that HHI leadership team C-suite members are expected to attend the 15 meetings? And the answer to that is yes. We are setting the bar high. This is our expectation. We know that it might not always happen, but we really want to set this out because this is important work. This can't be done in short term. And so we are hoping that this is what we will see. And we understand, of course, that there are always contingencies, but so far we want to just be clear that this is our expectation.
I want to weigh in just really quickly, and then I'll read the next one
No,
for you
ahead.
guys. So one thing, just to clarify, it says all C-suite members, and just to note that we're looking for 4 to 6 senior leaders who report to that executive sponsor. So it might not be the full C-suite; it's 4 to 6 people on that HHI leadership team.
Right. Good point. Thanks, Case. Another question, what can you tell us about how this pilot would work for and integrate with organizations that have established institutional well-being leadership and programs? So I think this is the key point of HHI, actually. This is a holistic framework. The point that we were making at the beginning is you can't have pockets of activity that aren't necessarily integrated or speaking with each other. For the full leverage of this framework, it does require integration of work amongst people working on diversity, equity, inclusion, voice and choice, people who are working on teamwork, people who are working on well-being. So I think the benefit of this program is a chance for leaders to really integrate this work across the organization or across later. We'll be dealing more with systems, not in this first initial pilot. But I think it is a really golden opportunity. And I worry that the work isn't getting the full leverage that it might. So we want force multipliers to work together on this, as they say in the military. Cost, Case?
Yeah, so I can talk about cost and also one other point that you just made because it was asked later on. So first of all, cost, simply for this pilot, the cost is being a Schwartz Center member in good standing. So for this pilot, there is no additional cost beyond Schwartz Center membership. And we want to, can underestimate the amount of value add that is to the organization based on how much we know that this is worth. We're getting these amazing experts in. So there is no additional cost beyond being a Schwartz Center member in good financial standing with us. And then finally, not finally, but another question that came up and was answered in Beth's answer, which is this being done system-wide or per each hospital? And for the purposes of this pilot and the research that we're doing, we are doing this at a hospital or healthcare organization level, not system-wide. So if you are a system leader listening into this webinar, thinking about how to start this work within your organizations, please think of what hospitals or healthcare organizations within our system would be a good fit for this pilot, and have those organizations that are Schwartz Center members apply for the pilot project. We are not, for the purpose of this research study, for this first pilot, doing a system-wide rollout, rather working with individual hospitals. Now, let's look at other questions. There's so many.
Well, there's another question about how many organizations. No one has signed up yet. The applications are going to open up the week of October 3rd. We want 6 pilot sites to work with for this first pilot year. And then beyond that, we'll open it up more widely. So let us move on to the others. There are other programs that are straightforward, such as What Matters to You. How is this different? Casey, did you want to answer this?
Well, I was going to say there's a couple of questions in here about what is different about this program, what makes the HHI pilot projects stand out from others, and there's a couple of different things that I think are really impactful. One is that we are going to have Schwartz rounds as part of the pilot group, so that's something that makes our HHI pilot different than other organization or organizational impact projects like this, and also really the experts that we're bringing in to support a lot of the work that's being done. And Beth, I'm going to turn it back to you to see what else you want to share about how this is different than other programs.
I want to make one point. This is a trauma-informed program. So whereas I think many other programs are focusing on quality and patient care, this is a program specifically for the healthcare workforce that is trauma-informed and ultimately meant to create compassionate healthcare cultures. We're focusing on senior leadership because, to a large extent, that's where culture is born. But we are also parts of that culture. And so we can participate in this by supporting it. The other thing I think is that in these sessions with these teams, there's going to be learning collaboratives across all of the sites. So people are going to have a chance to learn together and to find out what's happening and what's working in other organizations outside of their healthcare systems. And that is actually a really golden opportunity. So we'll have these learning collaboratives. The other thing, in addition to the experts in the coaching and the leadership coaching, is that the Schwartz Center, our way of doing things is to be relational, to be supportive, to be compassionate with each other. And that is what we will infuse this entire program with for the senior leadership team. And we're hoping that by having these experiences, they'll be able to demonstrate it towards each other, first in the team, and to value it as a set of values that are demonstrated by behaviors when they're dealing with the rest of their work, with the rest of the decisions they're making, with the rest of the workforce. I think this is very unique to the Schwartz Center. I don't know of any other organization that is or could be doing this. So I hope that answers that question.
That's great. Beth, let me read the next question to you, and you can answer it from there. So with organizations that already have active work in just culture or DEI, for example, could the organization choose to focus in specific aspects or use the framework and pilot to integrate existing components?
And the answer is yes. Yes. Absolutely. And, we can certainly talk about that some more. But again, I think one of the key features of HHI is that it's one of the purposes is really to integrate all the good work that's already going on, but to really bring the senior leaders into the same room talking about these issues of what does it mean to be compassionate leaders? What does it mean to establish compassionate healthcare culture? And again, you can't have that without all of the key principles involved. Thank you for your support to Rhonda Abbott, who asked a question. Is there any funding? No, there's no funding for this pilot. I think I do want to make the point that the value of this program is probably in excess of $500,000. This is consulting services and expert discussions that would be extremely costly to your organization were you to have to pay for them. We're offering them for free. So no, we don't have any funding, but on the other hand, the value you're going to get, I think, is going to be substantial. Okay, for an organization to participate, does it have to be the entire, or can you apply to pilot within a specific role or discipline? The answer to that, I'm sorry to say, is no. We really need the senior leadership team to be involved, and that would be the leadership team across the organization. And then we have another comment: if our hospital has existing programs like RISE, can we still be considered? No, absolutely. And again, I want to keep making this point. We're not competing with existing programs. What we want to do is bring your senior leaders into relationship with each other and to think about culture change in a different sort of way. All of these other things that you're doing can be components of your well-being initiatives, but that still leaves all these other key principles that really need to be addressed and thought about. And if only to think about, how is my initiative addressing psychological safety or physical safety? How is my initiative affecting diversity and equity? So that is the purpose of HHI. It's holistic, it's a trauma-informed framework. It's meant to integrate work that's going on or to introduce new initiatives and projects across the organization. It's meant to change the culture within the senior leadership team and then hopefully change the culture within the organization itself. I hope that answers your questions. I think this might be one more.
Yeah, there is another. I want to echo that because I think, Beth, what you were just saying is so important. We keep getting sort of different variations across both the first webinar, info webinar, and this information webinar about how this integrates with existing programs. And I think the sort of the beauty of it is it's both, we know that everybody's doing something that aligns with some component of the framework because the framework is so holistic and so inclusive. And so there is not competing, it really can be additive and support both existing programs and create new work for you. So I think both things are true. And then Eric has this question, which is, how will post-pilot year programs differ from this first year?
Yeah, I'm excited to answer that. Just like you all, you base change on data. And that's really part of why we've chosen to involve our really good friends and incredibly excellent evaluation and research partners, Goodman Research Inc. We work with them on all of our programs to date. And so whatever we learn from the data that we collect, we're going to use it to improve the program, to tweak the components, to see what's most effective. What do people get the most out of? So we are going to be changing this program, but I can't tell you how now because we don't have the data yet. But tune back in and you know, hopefully we'll have some more at the end of the pilot year. So one more popped in. Thank you very much for your support, all of you who have made positive comments in the Q&A. We're so excited about this. We really hope you will take this opportunity to join us for what is going to be an amazing opportunity. And you know, we'll look forward to hearing more from you, and I hope that you'll look forward to hearing more from us about this initiative. So with that, Case, I think we might be at the end of our agenda here.
Yeah, I want to reiterate that the applications for this pilot will be open in the next week. Please keep your eye out for that email coming the week of October 3rd with the application link in it and also the supportive resources that you can use with your team. So please stay in touch. If there are any questions about this, you can contact us at membership@theschwartzcenter.org, and we look forward to seeing the applications.
Thank you to all of you, and thank you to my team here on screen. Take care. See you later.